I wasn't able to get it healed. Other doctors just couldn't do it. They tried everything they could, different procedures, but nothing was working.
And I spent, I think, 4 days in the hospital, and I had 4 different doctors prepare me for the amputation of my foot. I was ready to lose the foot, and I didn't want to.
They actually sent me home with my toes still being purple. And I've been thinking about that. How could they do that? You know, why didn't they do something, you know? Was there, the only thing that they could think of was to cut them off? You know, that was my thought.
I didn't have any more skin left. And so my wounds that had normally, pressure wounds that had normally healed over and over again, stopped healing.
I went into the hospital, they admitted me, they tried all sorts of different topical treatments. I had 6 different wounds on my left ankle, 7 different IV antibiotics. Nothing was working.
I guess the fear is that the wound is going to be so traumatic that you are going to lose your foot.
We founded Wound Care Advantage in 2002. Over the last decade, we've watched hundreds of changes happen in our industry, both healthcare and wound care. But one thing that's stayed constant is we have stayed true to the 6 rules we founded the company on. And the first rule is patient care is everything. The most important thing we can provide is exceptional patient care, allowing patients to heal quickly. We believe if you save a limb, you can save a life.
I've had this one for 4 years, and I heard about Central Linda and Dr. Gamble. We came in and went in the lobby, and he came out to the lobby to talk to me and looked at it, and he told me he could help me, and he did. And today is the day he told me it's healed.
I was so fortunate that the Wound Care Center became involved because many of the physicians that were brought in to try and figure out the correct diagnosis, you know, had never heard of pyoderma gangrenosum before. Statistically, it's 1 case in about 100,000 people per year. They initially talked about debriding it, you know, scraping it, all of this, and, you know, it was really almost a divine intervention because Dr. Gamble came in and said, no, 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 no. And with the infection specialists, they figured it out.
Coming here was one of those things I had to do to take care of the wound. Leaving here was equally traumatic because I felt like I had built a relationship with all of the nurses and the doctors here, like a family.
The staff here, I can't tell you how wonderful they are. You know, every one of them, you know, just treated me so well. My other foot doctor, I went in to check with him, and he says, "Are they good to you over there?" I said, "Are you kidding me?" Yes, very, very well.
They just knew what they were doing. It was, you know, I had been to a lot of doctors. I had been through a lot of surgeries. So I came here, we started healing naturally, I changed my lifestyle, and I'm on the road to recovery now.
What I'd like to say about the Wound Care Center is that they gave me hope. Probably was the most important thing that they could have done for me. And it worked, and the better my foot got, and the more progress I was making, the more I look forward to coming in here.
I've been very pleased with the Wound Care Center staff. I think their compassion, you know, and caring, and, you know, when things, you know, kind of took a dip and I got reinfected and, you know, I had to go back on antibiotics and I wasn't feeling all that great. And the team here of nurses and assistants were caring, communicative, answered all my questions, you know, understood my frustrations. Today is my last day at Wound Care because everything is healed. I'm free.
The positive part about it is actually seeing it work, you know, and seeing that Dr. Gamble knew that it was working. You know, that took a lot of stress off.
I couldn't have done it without the crew here, and they really helped me heal faster than I would have healed on my own.
It's been such a great experience. You know, you wish you could have other experiences like this and other things, you know, but yeah, I think that's going to be the hardest part.
I feel like I want to shout it to the world. I mean, I thought, oh my God, I knew he would do it. I just didn't know when it was going to happen. And when he told me today, you don't have to put anything on it, I knew I was sealed. I would recommend him to anybody who had a wound to come here.
Yeah, I think the positive attitude does an awful lot to heal. And this is a place that epitomizes a positive attitude. That's been my experience. I'll never forget this place.